So talking a little bit about the sort of post-labour stage now, I mean, there are some really lovely traditions in other cultures providing kind of a lot of practical support for new mothers and allowing them to recover and really bond well with baby. And that's something that's often missing in Western culture. Do you kind of help to guide women on ways to make sure that they're fully supported in that recovery phase afterwards? And how can herbs help with that as well?
Yes, yeah. Well, I do think it's a time when, in our culture, as you say, a lot of women, sadly, are very much on their own. Which so I definitely try and encourage people to look at ways of how they can be supported afterwards. So yeah, that's a huge area actually where a herbalist can both emphasize the need for that, because it's not even really much mentioned, is it? You know, and the whole emphasis very much afterwards, after giving birth, is often on the baby, yeah, which is great, but the mother needs so much emphasis as well. It's
a huge thing for your body to go through, isn't it?
Yeah, it's a huge thing for your body to go through, and not just your body, but mind, spirit, everything. It's such a big change, especially a first baby. But then with subsequent babies, you've got all the other potential children around as well. You know, so however many pregnancies and births you've had, it's a big thing, isn't it? So yes, I think herbalists have a huge role they can play there, both in giving. It's almost too much to go into in a short chat, really, Marion. But in terms of because I offer all sorts of services, like, say, you know, sometimes. Well, I don't perform things like a doula who would go. I mean, it's great if someone can have a doula who goes to their house and supports them, or if they've got a really helpful partner who can have time off. And I mean, just practical things like cooking food in advance and having it in the freezer, and lots of stuff like that. But in terms of herbal support, I do think herbal postnatal tonics are vital.